Welcome to Sabra Says. I'm Dr. Madsen, licensed clinical psychologist with over 30 years of experience bringing psychology insights to you. Today we're going to talk about memory decline, specifically related to presidential competency, which is in the headlines right now. We've all seen it. We've seen these video clips with the media where they will focus on different candidates in situations where maybe they forget a word that they're trying to say, where they get confused and say the wrong word in a situation. Maybe even, well, we've seen it where, they lose their balance, they fall. And the media just like really harps on this because, well, for political reasons, they're trying to make candidates look like they're incompetent. And when people see this, it creates this misconception that the person may have dementia. And as a psychologist, I personally find this misunderstanding kind of annoying. Because of it, I thought, well, this would be a great thing to talk about. With a specialization in neuropsychology, I do a lot of memory testing to assess people to see if they have dementia or not, or if they have, just normal age-related memory decline, which happens. And a lot of people do not realize that happens, and it is normal for everybody as they get older. There are some really strange exceptions of people that are super sharp, until the day they die, but even they had declined from their baseline, which was probably higher than the average person. So, just for reference with age right now with our presidential candidates, Trump right now is 77, Biden is 81. By the time of elections, they're going to be 3 years apart because Trump's going to be turning 78. So in order to understand this, it's first important to talk about norms. So norms are basically a way for people that do research to determine whether the data that they have is in a normal range or if it's significantly impaired. And the way that we do this is we collect data from thousands and thousands of people, and they're randomly selected from the population, and then they figure out what is the average, okay? And they break it down into groups. So based on age, gender, and education typically. So if you were to be assessed, say, for intelligence, we would do the standardized test, the same test for everybody, done exactly the same way. And then we would take your data and we would compare it to people your own age range, education, and gender to get the best idea of, where do you fall in that range? And then there's standard deviations to determine whether it's a significant difference or not in either direction. That's how we determine if somebody is gifted or if they have an intellectual disability. So in this case, with memory testing, we do the same thing. We do memory testing, that's a graduate level program. There's a lot of information there, but we do comprehensive memory testing. We take that data and then we compare it to norms to see if it's significant or not. So with aging, it is completely normal after the age of 30 for, this is depressing, for everybody's memory, and honestly, overall cognitive ability and physical ability to start declining. So after the age of 30, and we see it in the norms. So if you look at like the average scores after 30, they just like progressively kind of go down, and we feel it as we get older. I mean, we do. We may start compensating by making lists, by, just being more organized, keeping a more detailed calendar, because the first things that tend to go are our working memory and our processing speed. So how well we hold information for short periods of time, like things we need to remember at the grocery store, and then how quickly and how fluently we're thinking. Our language as well, that word finding is also, impaired as we age. For reference, language, I just jotted it down here. Prior to the age of 59 on a language test, people are able to state 40 words, right? After the age of 80, that drops down to 30. So there's like a significant difference there, and both our presidential candidates are in that range of 80. They both are. So it's not really an issue of like, is one, like better off than the other. They're in the same age bracket. The only difference would be is if one actually had dementia, which is totally different than normal age-related memory decline. Okay, so with normal age-related cognitive decline, we see deficits, like I said, kind of going down, but mildly. Okay, so it's a mild decline in working memory, processing speed, everything, your balance, your motor skills. The media loves to take pictures of them tripping and falling and saying, oh, see, they have dementia. That does not mean that you have dementia. It just means as we get older, it's harder, and we're more of a fall risk as we get older. But the key here is that it's mild decline. And when we compare to norms, it's within the mild range. It would look normal compared to that people that we're comparing to that are the same age, if that makes sense, that do not have dementia. With dementia, when we test them, we do the same thing, the same tests. We compare them, to people their own age, gender, education level. But what we will see is significant decline. Okay, and that's a statistical determination that we make based on the numbers. So when there is a significant decline, that is above and beyond normal age-related decline. But that is not diagnostic just in itself. There's also issues related to functioning. Can the person function in daily life? Are they able to manage their medications, the bills? These are the things we see usually, like the spouse will start taking over those responsibilities. In conversation, do they forget things and then look to their spouse for the answer? Disorientation, forgetting where they are when they're driving, forgetting where they're going, not knowing like the date at all. Who is president, at the time, just general orientation. Their reasoning ability starts to decline. Their judgment starts to decline. We also see behavioral changes like agitation. Sundowning is common, like at night, where people become more agitated when they have dementia. There might be mood changes. So it is a lot more complicated than just normal age-related cognitive decline. And then, on imaging, we can actually see on brain imaging that there's atrophy where the brain actually shrinks, and we see other indications as well of dementia that somebody that doesn't have dementia wouldn't have. So it is totally two different things. And I think then, the question is, let's assume that neither candidate coming up has dementia. They're just old and they're not as sharp as they were when they were 30. Are they competent? So the competency then comes down to more emotional and personality factors. Is the person self-aware? Do they understand like that they are, maybe declining in certain areas and they might need assistance, that they might need to rely on people who are younger or, have more experience or knowledge around them? Or are they in denial, and think that they're just perfectly fine and they don't need anything? Because if they're not willing to accept the assistance, then we have a problem with their ability to perform their job. And that's in any job. I'm not talking about just the president. So the personality part is the humility. The emotional part is the self-awareness. And they need to have both. How do we know that? That's debatable. But if we're going to have a president, which it looks like we are either way, that is, in the 80 range, they are going to need to be self-aware and humble and use the people around them appropriately. Do they have dementia? So Ronald Reagan was diagnosed with dementia. He was diagnosed with dementia, I think 6 years after his presidency, and people often have it, prior to diagnosis. So it is debatable. There is There are people who believe that he was actually in the early stages of Alzheimer's at the tail end of his presidency. It wasn't really noticeable because it was an early stage at that point, and he had people around him helping him. But it can happen. I mean, it is possible. But if they are able to function at the level that they're functioning, in that role, they either don't have dementia or they're very, very early stage, where, as long as they use their accommodations and compensatory strategies, they should be fine. So, really what's important here is like the character of the person and their self-awareness and their humility, and then we can take advantage of the fact that with an older president, they do have more experience. They have more life experience. Hopefully they have some wisdom. Hopefully they have some maturity. That's not always present as people get older, but hopefully. So I hope this clarifies the difference between normal age-related cognitive decline and dementia, so that you can make a well-informed decision on a voting day. Thank you for listening. Feel free to leave comments, or if you have questions or suggestions for future videos, I'd be more than happy to take a look at that and try and talk about things that people are interested. Just remember that we're all a work in progress, and be kind to yourself, and have a great day.